In the headlines, His Majesty the King grants Dar to the newly elected Trompins of Phuentsholing and Gelifu. DT leaders in Samtsi propose reducing rural timber allotment eligibility period of 25 years. And India extends the gap between 2 doses of the Covishield to 12 and 16 weeks. And Kuzankula, and welcome. You are watching BBS News. My name is Chinko. His Majesty the King granted Dar to the newly elected Trompins of Phuentsholing and Gelifu in Phuentsholing this morning. The Phuentsholing Trompin Uttar Kumar Rai was re-elected to the office, while this is the first term for the Gelifu Trompin Sringnobu. The third term the election for Gelifu, Phuentsholing and Thimphu was held on the 28th of last month. The National Referral Hospital faces growing demand for quality and diverse healthcare services, being the biggest healthcare facility in the country. So in line with this, the hospital is going to introduce 9 new services this year. It hopes to reduce patient referrals abroad.
The hospital surgery department recently introduced minimally invasive surgery. It is any surgical procedure performed through tiny incisions. The department will roll out 2 more services, pediatric urology and extracorporeal shockwave lithotripsy, by this year. The pediatric urology program provides a comprehensive treatment of genital and urologic problems of infants.
Extra shockwave lithotripsy, that is a procedure by which a shock wave is delivered by a medical equipment into the body of a person, especially if it is directed towards the kidney. It will break the stone, and once the stones are broken into very small pieces, the stones they pass out in the urine, so that you do not have to open or cut open the patient to remove.
The hospital will also introduce bone densitometry and bronchoscope services.
A bronchoscope is an instrument that is used to, that can be introduced into your lungs from the oral cavity through the trachea into the lungs. And then the instrument can be used to either take small tissues for diagnosis, especially in the with reference to cancer.
Other new services would be a joint replacement, a surgical procedure in which parts of an arthritic or damaged joint are removed, dental implantation to treat severe teeth problems, and dermatology laser for skin problems. The cath lab, which is also a new service in the offing, would be an examination room equipped with diagnostic imaging equipment to detect heart-related diseases.
We could not send our health workers for training, so that's why that has impacted the implementation of the new services.
However, the hospital management is all upbeat to start these healthcare services within this year. Choni Dhamma for BBS News.
To reduce the risks of COVID-19 transmission, the escort mode of transportation between Phuentsholing and Sorchin has been suspended until further notice. Only driver switching modality will be used from tomorrow. The decision came after a few drivers ferrying goods between Sorchin and Phuentsholing tested positive for COVID-19 recently. Starting up cottage industries in the country is expected to be much easier. To achieve these, the Economic Affairs Ministry launched the online registration of cottage industries and its guidelines today. The ministry also launched the CSI Technology Request Database for easy sharing of knowledge and technology to aspiring entrepreneurs.
Allow first and regulate later. In line with this principle, the Ministry of Economic Affairs launched 2 new products. The initial challenges faced by any aspiring entrepreneur are the regulatory and administrative burden in having to submit numerous documents to different agencies. It is both tiring and time-consuming. With the new guidelines, an applicant for cottage industries can simply apply online and obtain a registration certificate. The highlight of the new guidelines is the registration certificate, which replaces the current licensing system.
Earlier registration system with licensing, we had hassle of visiting the offices, and now with this online registration, I think at the comfort of your home, you can just be on the laptop and register.
An applicant can apply for the registration certificate through the G2B website. People are urged to read the guidelines before registering. The process is simple. The entire procedure to get a registration certificate takes no more than 5 minutes.
Registration 배우다 고 뒤에 따분고 로숨기 된달로 registration certificate.
One doesn't have to pay a fee while registering. They will get a registration certificate for 3 years. Most businesses, while applying, won't need any clearances and will get the registration certificate immediately.
License ditulera registration certificate ditulera 더 없이 신이라.
Similarly, the CSI Technology Request Database will facilitate entrepreneurs to search and adopt the right and appropriate technology required to start a business. The online database will serve as a means to exchange technology between people both within and outside Bhutan.
In today's scenario, most businesses, including the cottage-scale industries, are facing the challenge of getting the right resources for their businesses. For instance, someone looking for a bakery equipment doesn't know from where and how to obtain the machine. With this CSI database technology, they can easily access the information on the products and its prices.
This will be one of the first reforms on the smallest scale the ministry hopes to implement in the future across all sectors of the economy. And those currently holding the cottage-scale licenses are requested to convert to the registration system on or before expiry of the license validity through the online G2B application process. Ishtoji, BBS News.
Timber to construct houses in rural Bhutan is allotted as a subsidy to rural households. It means households are given timber without having to pay for it. But the eligibility duration of each allotment is only after a gap of 25 years. And this gap is inconvenient for rural residents, especially when a household divides into newer families. The Dzongkhag Sokdo in Samsi recently discussed the need to reduce the allotment eligibility period to 12 years.
In Dinchukha Gyok Samsi, 62-year-old Indra Bir Gurung is assisting his son's house construction. As the head of the household, Indra used his subsidized timber allotment in 2018 for his own house.
I have 5 children. I got timber when constructing my own house, but I won't get it again for another 25 years. So, for my children, it will be an issue to get timber when they construct their own houses.
For now, Indra's son borrowed timber from the neighbors with the promise to return it when he gets his quota.
He didn't get his land record or term yet. He will get timber only when he gets the term in his name. We get timber only when we have term in our name. So he has to apply for timber once he gets his term, but I'm not sure if it will be that easy.
Elsewhere, the situation is the same. This house is also being constructed on borrowed timber.
I am constructing a small house here, but I have a large family recorded as one household and getting timber is difficult. So I am constructing my house by borrowing timber. If we construct one house, then we have to wait for 25 years for another timber allotment. So I am requesting for timber to be allotted after every 10 to 12 years.
At least 10 to 12 years.
Raising the issue in the Dzongkhag Sokdo, the Denchukha Mangmi Kumar Singh Limbu said, rural people should be allotted timber when households divide, apart from reducing the allotment frequency to 12 years.
From our perspective, the rule needs to be amended. The reduction in allotment frequency will lift a lot of burden on people. The district chief forestry officer told us that this issue is not just pertinent to Samtsi, but is of the entire country.
Since the Dzongkhok Tsokdo has no authority to decide on the matter, the meeting agreed to forward it to the National Assembly for deliberations and to MPs from Samtsi. Sherab Doji, BBS News, Samtsi.
Sheep rearing in Merak, Tashigang has been declining over the years. The cause, losing the animals to diseases and wild animals. Despite all the challenges, there are still a few families in the Gewok who still rear sheep.
60-year-old Pema Doji is taking out his sheep to graze at the Chapling pasture land. He has been a sheep herder for almost 25 years now. While most people in Merak gave up this trade, Pema and his wife carried on. Pema goes along with the animals and shouts out regularly to keep away the predators. Meanwhile, his wife Nobu helps out with works such as shearing the animals. Wool is the only source of income for the family.
In a year, I shaved the animals 3 times. I used to sell wool for 350 a kilogram. But since I cannot get dairy products from my sheep, I exchange the wool with butter, cheese and other dairy products with those who have cattle.
The couple earns around 100,000 yutam from selling sheep wool every year. Besides threats from wild animals and feral dogs, the animals falling sick to different diseases have also become a concern.
During the winter, I bought around 130 sheep. But I don't know what happened. More than 20 of them died in the summer. It is really upsetting because we solely depend on the animals. The sheep are like family to us.
They say it is easier to rear sheep compared to looking after yaks. To keep away the predators at night, Pema keeps his animals inside steel fences, which he received as support from the government. He adds that the installation of a wool processing machine by an EU Helvetus project has also been encouraging.
I don't have much money, but if I find anyone selling sheep, I will buy them. But there aren't any sellers. Now that we have a wool processing machine in our village, I think selling wool will be a profitable business.
Currently, Merak Gewok has around 15 households who rear sheep, out of which only around 5 have more than 100 animals. There are more than 350 households in Merak. For Sonam Dargi in Tashigaon, Sam Tendolkar, BBS News.
India recorded 4,000 deaths due to COVID-19 and more than 300,000 new cases in the last 24 hours. It has reported more than 4,000 deaths for 3 consecutive days, while the number of infections declined slightly. Meanwhile, the government of India has extended the gap between the 2 doses of the Covishield to 12 to 16 weeks from 6 to 8 weeks.
According to international media, despite facing criticism that the decision was taken due to a shortage of vaccine, India said it was solely based on science and health perspective. The Indian government said the gap between 2 shots of Covishield should be 12 to 16 weeks. A member of the National Technical Advisory Group on Immunization said the antibodies to fight the virus increased substantially after the 2nd dose, but the degree of their impact was not yet known. He said the data shows if the gap is increased, The antibodies increase by 40 to 50%. As of yesterday, India has fully vaccinated over 38 million people, which is about 2.8% of the population. According to WHO, the B1617 variant of the virus, first identified in India, has been found in 8 countries of the Americas, including Canada and the United States. The mutant strain has also been detected in Britain as well as in Singapore. The total number of recorded infections in India crossed 24 million. The number of people confirmed to have died from COVID-19 is more than 200,000 since the pandemic first struck India more than a year ago. Kinzang Haden for BBS News.
And now a recap of the main stories. His Majesty the King grants Dar to the newly elected Trumpins of Finsoling and Gelifu. DT leaders in Samtsi propose reducing rural timber allotment eligibility period of 25 years. And India extends the gap between 2 doses of the Covishield to 12 and 16 weeks. And this brings us to the end of the day's bulletin. For details, visit www.bbs.bt. Our reports are also available on Facebook, Twitter and Instagram. Thank you for watching.